Okay, now we have all spent the year 2025 and it's coming to an end. What is your take? What is expected of you at this stage of the year? Okay, let us look together. Five essential things that you need to check out for before you end this year. Very important things. Don't forget that as a human being, you have been walking around day and night to make the end meet. Your work schedule, to meet target, to feed family, to pay fees, your health, challenges, all over. You need to do what is called health auditing. Do you know what you need to check out about yourself? So if you're talking of health auditing, you need to now look at yourself. What has changed between beginning of this year and now? Two, what has improved about you? And three, what aspect of you need to give attention to? Very important. Prepare to enjoy next year 2026 ahead of you. So you may also need to do what's called health analysis that you must not skip. You cannot afford to skip it. If you don't do your health analysis, you will not understand the kind of risk you are at. You will not be able to know how to track your progress, how well you have done in terms of your health. It's not only how well you have done in terms of your business, in terms of the monies you are making, like we used to say on our platform. The best enjoyment of life is a healthy life. So once you are healthy, you are the one enjoying this life. You're not healthy, you're not enjoying life. So you will need to detect silent conditions early enough. You're getting to your 40s and 50s, you don't know that you need to detect what could be a source of problem for you, complications. Again, let us do a deep dive into your health. When I say numbers, there are certain information about you that are just numbers. So when you have those numbers on your fingertips and you know them from time to time, you can track your progress, you can identify where there's problem. Take your pen and put it down. Number one, your weight and your height, your body mass index. It tells all the story. If you're having back pain, chest pain, leg pain, knee pain, sometimes nothing's wrong with it. It's just about the BMI that is bad. Number two, your respiratory rate, the number of times you breathe in 1 minute. The nurses do that for you in the hospital. Number three, your pulse rate. When they put your hand somewhere here, how many times blood is moving in your body? For an adult, it's supposed to be 60 to 70 times within 1 minute. Those numbers are fixed. There's a range. So you must know those numbers. It tells all the story. If your respiratory rate is more than 18, the number of times your chest breathe in 1 minute, it means something is wrong. And if less than 12, it also means something is wrong. Again, you talk of your blood pressure. That's the upper one and the lower one. Tells all the story, how your heart is functioning. So these numbers are very, very germane about who you are. Now you can do your kidney function test. It's also numbers. Your electrolytes, your urea, your creatinine. It comes with numbers. It tells all the story. Or your liver function test is also numbers. Once we see the result of the liver function test, we know this liver is gone. The five essentials are very, very simple. Number one is your blood sugar. You see, it's becoming a problem now that you cannot know whether your blood sugar is bad or not because it doesn't come with some symptoms that are obvious to start with. Example, when you start feeling tired and dry, you want to take water all the time. With this weather, you think, yeah, because the weather is now harsh, you want to take more water. Then you will know you're thirsty. You urinate frequently. You may need to check the value, fasting blood sugar, and 2 hours after food. Or you check what is called glycated hemoglobin. That's the HbA1c. When you check that, it gives all the information about yourself in terms of blood sugar system, how well is your body managing sugar. Again, you need to check your blood pressure because it ranges from no symptoms to early symptoms and to complicated symptoms. Your blood pressure is been normal, but suddenly it changes over time. Get back to normal, and you're unable to detect because you don't have any symptoms. So when you begin to have the following symptoms, then beware, your blood pressure is already bad. One, headache due to blood pressure. Two, chest pain due to blood pressure. Three, your eye is paining you due to blood pressure. Four, you feel like vomiting due to blood pressure. These are terrible bad signs. And finally, you urinate frequently more at night. due to blood pressure, then you are in trouble. So these are early symptoms of high blood pressure that you might need to note down. Then the complicated symptoms are: one, feeling tired. You just step on staircase 1, 2, 3. You are tired. Before you can finish the 10 steps, you want to stop like 2 or 3 times. Something is wrong with you. Or you lie down in your house, your bed, without pillow. You cannot be comfortable. Try in your house, remove the pillow and lie down flat, and let's see how it happens. So if you're able to lie down without pillow, then your heart is still doing well. Number 3, you will need to do your kidney function test. Go everywhere today. Somebody donating kidney problem. Yeah, it's everywhere. Check out your kidneys. Sometimes it does not produce symptoms. But among the early ones is that your leg is swollen. But it's not only kidney that can cause leg swollen. Or you notice that your face is swollen when you wake up in the morning. Or you know that you pee and it foams like soap in a normal place. Then that is something is wrong. Or you realize that your pee is reduced. It took like about 3 sachets of pure water and your urine is less than 1 sachet of pure water, then beware, something is wrong. And number 4, you check either male or female, prostate and breast. Hey God. This is now becoming an issue in our society. Early detection is the only solution. There is no sense in waiting for it to become cancer and thinking that there's treatment. No. If you are able to prevent it from occurring, it's the best of you. So an early detection will help. For male, prostate enlargement is now the major problem before it turns to prostate cancer. For female, breast lump is the major problem before it turns to breast cancer. And early detection is the way out of the whole trouble. And finally, you check your cholesterol, especially when you are getting of age and you have blood pressure. These 5 areas I've mentioned. Sit down and listen to this episode again. Please, you can share it and ask questions. You can actually consult with us online. We guide you appropriately on how to do this.